close to having to do the same this year, we have managed to salvage some vestige of it thanks to this modern technology of Zoom and computer progress. So, a very warm welcome to all participants. Assalamu alaikum once again. Our topic this year is very difficult and challenging one indeed. In this unequal and unfair world, we have to work out how we can achieve equality in health. We must avoid the tendency of us all to think difficult equals impossible. It does not. If we succumb to the easy way out, we will have lost the battle before a single blow has been struck. What we have to aim for is working for an equal access to the necessities of health, namely clean water, sanitation, adequate nutrition, basic housing, education, and opportunities to work. Not an easy task, but one which has to be tackled. I'm really looking forward to hearing from each of the fresh and hopeful minds which you, my young friends, have. We have got to put our heads together and see what we can achieve towards our goal, if not at least in some measure. So come on, let's begin in the name of Allah.
Thank you, ma'am, for your thought-provoking speech. The second message is from WHO representative in Pakistan, Dr. Palitha Mahipala. I would request Madam Fatma Munir Ahmed, Vice President, Madinatul Hikmah, MD and CEO, Hamdard Laboratories, Waqf, Pakistan, to share his message with us.
Assalamu alaikum, ladies and gentlemen. A very warm good afternoon to distinguished guests and beautiful children. This message was sent by Dr. Palitha Mahipala, WHO representative, head of Mission Pakistan. I wish good health and safety to all of you during these challenging times. I congratulate the Hamdard Foundation Pakistan for organizing this event on the eve of the World Health Day. Dear children, as you know that World Health Day is celebrated annually on 6th of April each year, draws attention to specific health topic of concern to people all over the world. The theme of 2021 is building a fairer, healthier world. This theme is very much relevant to most of the low and middle income countries of the world, including Pakistan, where 40% population lives below poverty line. Some groups struggle to make both ends meet. With little daily income, have poor housing conditions and education, fewer employment opportunities, experience greater gender inequality, and have little or no access to safe environments, clean water and air, food security and health services. This leads to unnecessary suffering, avoidable illness and premature death, and it harms our societies and economies. Another important issue is gender inequality, which is the most serious global human concern, which directly affects half of the population. Pakistan is nearly in last place internationally in terms of gender equality. Such disparities are a major impediment to economic and social development, as well as upholding human rights in general. By promoting the theme, building a fairer, healthier world, the WHO is calling on leaders to ensure that everyone has living, working conditions that are conducive to good health. Health equity demands that everyone has a fair and opportunity to be healthy. This requires removing obstacles to health, such as poverty, discrimination, and their consequences such as powerlessness and lack of access to good jobs with fair pay, quality education, and housing, safe environments, and healthcare. In our national role, we want to work with all of our partners, including government, NGOs, INGOs, CSOs, in making the case of change together to build a fairer, healthier Pakistan in which all of our people and communities have a fairer share of the opportunities, resources, and confidence to live together healthier lives by reducing health inequalities and improve health by providing care that does not vary in quality because of personal characteristics such as gender, ethnicity, geographical location, and socio-economic status. The government of Pakistan has launched several initiatives to address these issues, which include expansion of the social protection program Sehat Sahulat, launch of the Ehsaas program, and approval of universal health coverage package are a few of them. My dear students, This is just the beginning. There is a long journey ahead. We know that under constrained economic conditions and existing social and cultural norms of the country, the government may not be able to achieve this goal alone. All of us shall join hands to support the government of this noble cause. I am happy to the main audience of this event, our children, and being the future of the nation, it is important that they are sensitized about these issues. With this note, I would once again congratulate Hamdard Foundation Pakistan for organizing this event to commemorate the World Health Day. Thank you so much.
Thank you, ma'am. According to a report from the World Bank and WHO, at least half of the world population cannot obtain essential health facilities. Health is a fundamental human right, and WHO is committed to not only ensuring that everyone, everywhere can realize the right to good health, but ensuring the highest level of health for all also. Today, we hope to learn a lot about how to work in collaboration to achieve this goal.